Hi, I'm Sue Herbert. I'm actually from NHS North of Tyne, but I'm representing Throckley Primary Care practice today. And this is about the rapid improvement event we did about handling their incoming patient mail. And this is our story, and it is a bit of a story, I have to say. The characters are Throckley Primary Care Centre, which is a GP practice in the west side of Newcastle. NHS North of Tyne, which is a primary care organisation that covers the whole North of Tyne, kind of the name gives a clue. And the North East SHA. So staff at Throckley were near breaking point. They were actually on their knees. They had so much work coming in, and even though their patients said that they were consistently producing really good results for their patients, the staff were on their knees. The doctors were absolutely exhausted. They were dealing with sort of in excess of 50 items in their mailboxes a day. The delay that was caused by those not accessing their mailboxes all the time was then passed on to the admin staff, who had huge amounts of work to do when they decided they'd get on and do their mail. There was no specific time for any scanning. There was no allocated time. There was just so much scope for mistake. It was, wasn't good. And the postman was even getting scared to deliver the mail. He really was. No, not really. I just kind of added that for dramatic effect. But in all honesty, incoming patient mail, I thought I'd give you a little bit of wake up there with some mail coming down. Incoming patient mail was become a real problem. There was no mistake proofing, there was no standard work, and actually the reality of a mistake happening fairly soon was imminent really there. Throckley knew that there just had to be a better way, and they started looking at ways in which they could improve their service. Meanwhile, back in SHA land, the SHA, I believe that it was on an aeroplane somewhere actually. I'm sure Ian would be able to tell us a bit more about that. The SHA discovered Virginia Mason production system and thought it was absolutely wonderful. It was all fluffy clouds and ice cream, and so they thought that they would roll it out to organisations in the North East and say, how do you fancy clubbing together, getting some training, and we'll really go for it and make some lean working happen. So that's exactly what happened, and they all clubbed together. And just in case you didn't know, the Toyota production system, I'm sure we've all seen pictures like this, Virginia Mason actually based their system on the Toyota production system, worked very closely with them, and they produced their lovely Virginia Mason house, which I'm sure you've all probably seen. I'm sure it's embedded in our Ian's brain over there. But basically, Virginia Mason have really kind of built the whole hospital on lean. They've saved huge amounts of money, time, and patient lives because of it. Is that the milkman? So training started. The organisations who decided to club together got started on some training, and we were supported by Virginia Mason in the States. We had a nice American person come over and support us. It was a bit of a grueling course, I have to say, having come out the other end of it. And it was kind of, at the end of it was a module marathon, and the name says it all. But it was really great, and we all came out of it with an OCD, really. So how did the two worlds collide? Where did Throckley and North of Tyne get together? Well, North of Tyne really embraced lean and did lots of improvement events, and then actually thought, it would be a really good idea to share this with the GP practices. So that's exactly what they did, and Throckley thought, hang on a minute, we know a process that could really do with being lean. So organised a rapid improvement event. So the rapid improvement event is a 3-day event as opposed to a rapid improvement workshop. Half a day's lean training, ideas generation. It's really important to generate ideas. PDSA cycle on day 2, more ideas generation. And then on day 3, we do the future state mapping, and then we terrify everybody by getting them to do a report out. And actually, it was a really, really good event. And the whole team was involved in terms of ideas generation, and it really kind of got the practice invigorated. So part of the event, we had a sponsor. The sponsor was actually one of the GPs, and he was really, really bought into it, which was very, very key to the event. Process owner, who was the practice manager. That's the person who owns the process once we've leaned it. Then we had the home team, and then we had the facilitators, one of which was myself. This was the project form that we came up with when we sat down and talked about what we were going to do, but we actually changed this through the course of the preparation of the Rapid Improvement event, and kind of updated it as we went along. Finding the scope, I think, of a Rapid Improvement event is really probably one of the hardest things, because you want to be inch wide and mile deep, not mile wide, inch deep. So what we did was we looked at all the different kinds of communications coming into the practice and decided that actually the patient incoming mail was probably the most important part of what they needed to change, and that would have the biggest effect, so the 80-20 rule. So we did this lovely current state map. We had a current state mapping event. We mapped this all out, and as you can see, the pink areas here, they're all areas of concern, and there was quite a few, I have to say. It was a process that had kind of evolved over a period of time, and I think when you're embedded into a process, you don't realise how unwieldy it is. So we got out on the Gemba. Do you all know what the Gemba is? I'm sure you do. We got out on the Gemba, and we timed the process from start to finish. We got the lead time. We actually followed the mail through the process as well to make sure we could identify any waste in movement as well. And we came up with this wonderful value stream map. Now, I know it's really tiny on there, but you'll be able to see some big figures in a minute. And this was the map that kind of showed us the lead time was 10 days, which was quite phenomenal for mail coming into the practice to actually getting onto the IT system and properly coded and filed. This is just an extract from that there, and you can see on there that's the lead time, 10.2 days. But when we measured it, the processing time, the actual time, the sort of value added time, was 6 hours. So there's all that waste in that process. So the event itself was attended by GP, practice nurse, 2 admin staff and the practice manager, and 2 PCT facilitators. And we kind of all got together, and it was a really, really good event. That's a bit of a mugshot there. Thought we'd just put that one in. That was coming to the end of the event, and we were doing the future state map. We'd all agreed on a process. We'd all decided that it was what the process that would come up with was really good, and it involved the GPs triaging the mail. So the mail would come in, admin would take out anything that wasn't patient related, and then the GPs would have a set time to go through that mail, identify what needed to be done with each piece, and then the admin staff could go on their way and do what they needed to do. And the effect of that was phenomenal. This is a target sheet. Again, I've kept the numbers small so I can give you a big hit at the end. We had to fill this in for every day at the end of each of the event, of each day of the event. And as we went through, obviously the figures got better and better, which was great. So that was our future state map. Much bit smaller than the previous one, and no pinks, which was great. These are the improvements that we made. All patients are seen by a GP within 2 hours of arriving at the surgery. I think that's pretty unique, probably across the UK, to be honest. I don't think any GP practice in the UK would see their post within 2 hours of arriving at the building. An 80% reduction in the mail processed by clinicians. 72% reduction in GP contact with mail. That's the equivalent of 3 calendar months of a GP. If you work that out, if this process was replicated across the north of Tyne for every single GP practice, that would be the equivalent of 30 full-time GPs, just with this one little process. And a 34% reduction in administration time. And a reduction from a 10-day process down to 1.2 days. So what did we learn? You really need to have dedicated time, a specific time to do something. You need to think out of the box. And the joint effort encompassing multidisciplinary team members has a huge effect on the staff morale, apart from anything else. Everybody feels like they're involved. And what we found, probably I found more than anything, was that the effect of the Rapid Improvement event on the practice was actually far-reaching, because we had engaged everybody, everybody just started to think about processes that they did in their work, and it's kind of had this blossoming effect on the practice, which is great. And that chocolate is absolutely the best motivator ever. They've actually done a further lean event, and now they've looked at their appointments booking process, and they're using a very, very similar way of looking at them, where the GPs are actually taking the phone calls from the patients and deciding what that appointment, what the best course of action for that patient is. So it's reducing things like where patient doesn't need an appointment, whether they actually need to see a nurse, not a GP, you know, whether they need a 5-minute appointment, whether they need a 10-minute appointment. And actually we're still measuring that at the minute, but it's looking good at this minute in time. They've also done some sharing of best practice. There are other, Throckley is a vision practice. It uses the vision as their clinical IT system. And they've actually been talking to other vision practices, but actually this process could be used on any clinical IT system. And I think that's the simplicity of it is so good because it can be replicated across any kind of system. And this is the saying that I like: there's nothing so useless as doing efficiently that which should not be done at all. We're all very, very good at being efficient at what we're doing, but actually do we need to be doing that stuff? And actually the one other little saying that I really like, and it was a practice manager that said this to me, he said, if we always do what we always did, we always get what we always got. And I really think that's so true of lean. I think that's, you know, absolutely true of lean. So thank you very much for listening. Have you got any questions?